right. Well, welcome to the McLean Hospital Crafting Support Project 2024 Family Webinar Series. I'm Dr. Julie McCarthy, and I'm a clinical psychologist and researcher at McLean Hospital. Tonight, I'm very excited to have you with us for a presentation on motivational interviewing for loved ones with Dr. Badiha Ipekchi from the Boston Medical Center. Okay, and so with that, I will get started with our agenda. Oops. So first, I'll be going over briefly what the Crafting Support Project is if you are new to our webinar series. And then we'll have the bulk of our presentation be on motivational interviewing loved ones or MILO. And then we'll have our Q&A discussion with Dr. Badiha Ipekchi, who will introduce herself a little bit more during her section. And then we'll end with a few minutes for closing remarks and resources. All right, so if you are here tonight, you may be coming for many different reasons. We welcome all of you. And to get a sense of who is with us tonight, we're going to do a quick poll on our audience. So let me pull that up. All right. So the question is about what best describes your role. So if you're a family member, a person with lived experience with mental health challenges, clinician, none of the above, or you could have intersecting identities, please feel free to put that in the poll. You can also have folks who are just interested in this topic, or perhaps supporting in other ways as support persons beyond traditional family member roles. All right, I'm going to close the poll in 3, 2, 1. There we go. Okay, so it looks like tonight we have primarily family members. So 95% of folks identify as family members, and we are so happy that you all are with us in any capacity today. All right, so let us go to talking about why we all are here. So the Crafting and Support Project Family Services is a set of a couple of things, but really is born out of this idea that if it's not us, it's probably someone we know who might have experience with mental health challenges or things that could become a challenge. And so in the spirit of maintaining all of our mental health and well-being for our loved ones and ourselves, this is a service which we are so thankful to provide with the generous support of our philanthropy donors to offer webinars for people who might just be looking for other information and ways to support their loved one, either enter treatment for the first time, perhaps, engage in peer supports, or really think about how we can support ourselves or the people that we work with or the people that we live with and love as they navigate recovery, because it's certainly more of a journey than a destination. And so for our webinar series, we've gotten through our first set of topics, and we are now on our July topic for motivational interviewing. And then we have some additional topics coming up later this year that are very exciting as well. And then we end with our family recovery night, which is where we feature people with lived experience with mental health challenges and family members to share multiple sides of the recovery journey. All right, and if you are joining us for the first time now or this year, we have recordings of our 2023 family webinars, which focus largely on things like community reinforcement and family training, or CRAFT, and wellness recovery and action plan on YouTube. So that's accessible anytime. And I should note, we do have a formal relationship with the folks who created CRAFT. All right. The other part of the Crafting Support Project for McLean families who have come through our Psychotic Disorders Division is free 8 one-on-one telehealth sessions with a coach like myself or someone trained in our team, where we offer individualized support and education for family members or people who have a loved one in their life navigating mental health recovery. So we cover things like communication skills, self-care, problem solving, positive reinforcement, healthy boundaries, things like that. So if you're interested, feel free to get in touch with me at jmccarthy@mclean.harvard.edu. And we're offering that through the end of this year. And this is a great service for people who are not eligible for our craft research study, or for people who have completed that but weren't able to get coaching through that opportunity. All right, so now our second poll is going to be a bit about our topic for today. And so that is trying to get a little bit of a sense of how familiar folks are with motivational interviewing. So if you don't mind, please feel free to share in the chat. How familiar are you with motivational interviewing? Unfamiliar, like you're completely new to this idea or topic. Minimally, like you've heard the term MI or motivational interviewing, but that's about it. Moderately, where maybe you've read or learned some details about motivational interviewing, but you're still a little bit newer, or very familiar. Maybe you've engaged in motivational interviewing training yourself, or services as a recipient or offering those services. Okay. So we'll give folks another second to finish out some of these questions. All right, and I'll close the poll in 3, 2, 1. Okay, so it looks like we have a bit of a mix today. So the majority of people are moderately familiar. You read into or gotten some exposure to motivational interviewing. Some might be brand new, so welcome. You're definitely in the right spot. And even myself, I could always learn more about this topic. And we have somebody who might be an expert as well. So thanks so much for joining from whichever background with MI you are coming from. Okay. So with that, I'm going to hand over the screen and the stage to our wonderful colleague and guest speaker tonight, Badiha Ipekchi. And so would you mind introducing yourself a little bit more so we can get to know you? And I'll stop sharing my screen so you can take it away.
Sure. Does everyone see my screen? Julie, you see my screen?
Yeah, that looks great.
Okay, let me introduce myself. I am Dr. Badiha Ipekchi. So I will be talking about motivation and interviewing for loved ones today. I'm super excited being here. And next slide, it has my information. So I'm psychologist and faculty at Boston Medical Center and BU School of Medicine. And currently I'm in a RAP clinic and motivation and interviewing for loved ones clinic. So it is a small sister clinic to RAP clinic. So let's get started with a little bit definition. What is motivation and interviewing? I'm glad that some of the folks here are already familiar. I hope it will be refreshing. So it is a communication style widely used by health professionals to talk about making healthy changes. It was developed by William Miller and Stephen Rolling in the early 1980s as a tool to help people with substance use disorders originally, but it has since been applied to a wide range of behavioral changes and therapeutic contexts. MI is based on the idea that the best way to influence another person's behavior is by respecting their first independence and creating space for them to explore their own motivation for change, rather than imposing external motivation, pressure, or control. It's very collaborative conversation. So why would caregivers want to learn MI and MILO specifically? Young adults and teens with SMI or complex needs, let's say, require a lot of parental guidance and support, and caregivers seem to try every tool to communicate better with their kids, such as going to their doctor appointment, taking their meds, doing even just simple chores, or coming to the dinner table, right? And these efforts bring the kid in the same page with parents might end up with a lot of frustration, arguments, disengagement, attempt to control, mutual escalations, and I think eventual chronic discord in the relationship. And sometimes parents might need to put their foot on or foot down, and which doesn't get the result you want. So a lot of parents carry around this shame about not being able to control or even just influence positively their kid or young adult child. So the fact is, and MI suggests that we cannot control them. The best we can do is to be the kind of person who they might actually want to take advice and guidance from. So at this point, MILO comes in, and MILO is an adapted MI curriculum for family caregivers. So it's not for therapists, it is for parents and caregivers. It teaches basic MI basics that are relevant for families. It can be also used everyday conversational context as well. It can help having better conversations, hopefully less argument, and eventually stronger relationship. So our goal is not over-involvement or disengagement, but healthy relatedness. It is what I like to call healthy relatedness. So it is a great way to work on connection, even if we don't get the behavior change we want right away. So to be able to share MILO concept, I would like to share with you a video. It is a very short video, so I need to stop my video right now, my screen. Then I will share the video with you. Okay.
It's just, there's all this pressure, you know? And sometimes it feels like it's right up on me and I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's gonna stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever gonna stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there.
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing.
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail
See, you're
out.
not even listening now.
Okay, fine. I will listen. Fine.
It's just, sometimes it's like, there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
That sounds really hard.
It is. Thank you. Ow!
Oh, come on. If you would just
Don't.
try to see things now.
Okay, I will share my screen again. Okay, so you can feel free to share your reaction into the chat box as well. So when we see someone we care about struggling, like the woman, right, in this video, we want to help them, and it's very natural reaction, right? But for some reason, they may not appreciate us, like this woman, right, in the moment. The guy tried to take the nail out, but it's not appreciated by her. Why? Because she doesn't have the insight about the nail. So, right, then she wants to be understood first. So what we call this guy's reaction as righting reflex. So it's like a fixing, a correcting reflex. So it is defined as the impulse to help others by fixing their problem, giving them advice, but unfortunately it leads to minimizing their issue. So MILO suggests that holding that reflex as much as possible to initiate a collaborative conversation. In order to consider a healthy choice or a change, people need to feel these three things. We call these three things MI spirit. These qualities are pretty abstract, so I will flesh it out a little bit more for you. MILO suggests that being conscious of what behaviors work for again and against the spirit during a conversation. If I contribute my kid to feel understood, confident, or in control in a given conversation. So I'm going to share a couple of tools to build understanding, confidence, and autonomy, hopefully. Empathy and curiosity to de-escalate power struggles. Empathy and curiosity conveys the understanding. I will talk about some simple behaviors and tools to communicate those qualities in the next slide. So first thing, reflections. You guys might be already familiar with this, and I might be already using this. Reflections are simple actions someone can do to mirror what the individual is feeling back to them. So they show that we can listen without focusing on what we want to say next, or trying to cut off a conversation because it makes us nervous or mad. Actually, when someone makes you feel nervous or mad, reflections become an especially useful way to slow down and change the lanes. Otherwise, we will just keep escalating each other. So just a simple definition, reflection is a statement, not a question. It's a specific, we are repeating back what we are hearing the person say or guess at the feelings beneath. It helps the person first feel understood and accepted and hear their own words, think a little deeper about what they mean. So I will share some examples here, as you see. Let's say young adult or adolescent says, oh, all my friends do it, so it's not a big deal, just get off my back, okay? So let's say it is the smoking issue. These are some of the reflections you might do. Oh, you feel like it's not a big deal. Smoking seems normal to you. My concerns are annoying to you, right? It's deeper a little bit more. I hate school. You hate school. School has been tough lately. Oh, you are feeling down. There is one more good reflection that you can use. I didn't put it here. It is double-sided or two-sided reflection. For example, on one hand, you want to go to the party. On the other hand, you feel that you can get a panic attack, for example. So it speaks to two sides of the ambivalence. So if you feel difficulty with coming out with a reflection statement, you can remember these phrases. I think they are really helpful. You can think, I hear you saying blank. You sound like blah, blah. It sounds like blah, blah. These phrases lead you to stay in the empathic thinking mindset. Sometimes I'm seeing that parents are like, get quiet. Okay, what should I say? What is the perfect statement I should be saying? Right? But when they start with these phrases, it automatically helps them to say something reflective. This face might be familiar to you, right? Reflections don't judge, and they neither praise nor agree, right, or disagree. So you might worry that using a reflection will make it seem like you are agreeing or accepting the other person's version as the whole truth, but the reflection won't do that. So you're simply showing that you are interested in their side of the story, interested in their perspective, even if your perspective is different. This is a really important piece. Some parents, I notice that they are a little concerned, saying like, my concerns are annoying to you, so you feel like I am bugging you. Particularly hard for some parents because I remind them that it is how the kid feels, and with a reflection you are actually not agreeing. You do not say that, yeah, I am an annoying person, right? You are just empathizing. So when parents make that mind shift, I notice that using reflection gets a lot easier. So reflections help them that you are really listening, you are there, especially if they're upset, right? It helped them to dial down the feeling like, oh, you feel frustrated. I hear that it's not fun to talk about. It's hard to have me bugging you about this. I'm getting on your nerves. Here, tone is really, really important. You don't want to sound judgmental, sarcastic, annoyed. I know this is also very challenging when you are frustrated in the moment. But just remember that nonverbal language also, conveys some messages. So these reflections keep the speaker in the spotlight. So you are not getting into back and forth. You are keeping the focus on their priorities. They are also a subtle way to help them feel in control. Even though we talk right now about understanding piece, you are actually building on control and confidence piece too, just through reflections. So because you are showing that you can listen without jumping in control, the direction of the control, okay? So let's do some practice. I would like to share with you 2 statements that I will ask you to put your answers in chat if possible. Therapy is dumb. For some reason, I can't see the chat. Okay, I see now. Okay, yes, you don't like therapy. Anybody else? You don't seem to. Great statements. I think you guys got it. I mean, you remember, you don't agree with them. You don't agree. You just share that you hear them, right? How about this statement? What is... Okay, these are all great.
And Badiha, just to jump in for a moment,
Yes.
feel free to share some of these out loud because we can see the chat, but our audience members can't see the chats from each other.
Oh, okay. Oh, I'm sorry. I thought
Okay.
that everybody sees each other. Okay, they say you think therapy is dumb, you don't see value in therapy, you don't feel therapy is helpful, right? You don't feel like it's helpful, you don't seem to think therapy will help. So I think that's quite enough. How about this challenging one? Marijuana is an organic remedy. Here, tone is really important. You don't want to sound sarcastic or annoyed. How would you make a reflection? You think marijuana is a safe way to medicate? You think marijuana, so you see marijuana as a positive approach. Marijuana is okay, but it is natural. Again, great answers. Okay, so let's move on to practice questions a little bit. This is our tool too. So asking non-judgmental questions shows that you respect and want to hear their perspective. So imagine that you need to have a conversation about whether your person has been attending therapy appointments and taking medications that their doctor prescribed, right? It's definitely not a fun conversation. And so let's say the question is a close-ended, so you want to make it more open-ended so that it helps them to get talking, right? What is going on with your medication? So starting with a non-judgmental, open-ended questions to get them talking. Remember, we wanna help them feel understood, confident, and in control. This three thing needs to keep signaling in our minds. Then our statements will shape by that, right? So they don't feel understood until they have a chance to let us know from their own perspective what's going on. Let's say here, are you going to therapy appointment today? Versus, how has therapy been lately? What do you see pros and cons, etc., right? So open-ended questions will probably give you more rich answer than just close-ended. Another example, let's say kid said, I'm not going to see that doctor again. Okay, what happened last time you met with her? Help me understand where you are coming from. What do you see as the pros and cons? You can also say a reflection first before asking this question. So I'm just sharing just simple examples here, not a whole conversation. So these are not didactic questions that you are asking to prove a point, right? You do not want to speak to their defensive side. In order for this to work, you have to be coming from a place of genuine curiosity. And you know, kids quickly understand, right? Sometimes when you're curious or not. So let's do some practice. Let's say therapy is dumb. Let's say you made a reflection, oh, it sounds like therapy doesn't work well for you. What question would you ask? Would you mind sharing in the chat? Okay. Can you help me understand how it is dumb? What makes it feel dumb to you? I'm curious. Okay, do you say this because of something that happened last time? Okay, is this once? Okay, are there issues they are not addressing? So maybe you guys can make questions a little bit more open-ended. I am seeing a little bit close-ended questions. Is the therapist not working? Right, it's close-ended. What is happening? Maybe like, what is happening recently that makes you feel it is dumb, right? This is more, that way you can get more answers. But otherwise, these answers are great. What would be more helpful in therapy? I think this is one of the perfect answers. Tell me how you think it might help is another great answer, right? Okay, so let me move on because of time limitation. I can't spend too much time this here. Okay, alternating questions and reflections. So the more time you spend making sure you understand, the more successful you will be when you challenge your loved one to make a change. Sometimes you need to stay in the listening space a little bit longer than you think you need to. So use more reflections than questions. So I suggest also using brief statement versus long chunks, because it can lead you to just naturally some advice giving, escalation, or writing reflex direction. And you can also hit one reflection, one question at a time. And sometimes you can do reflection, question, then question, reflection, question. That kind of mix, I think, help the person to feel like they are in the conversation and you are there to listen, instead of just asking questions, or reflections. Okay, so sometimes parents say, okay, I do all the reflections, this is great, but we don't go anywhere, we don't get anywhere, right? And we don't necessarily suggest to be the therapist, right? So you wanna influence your child positively. So how we can move to finding solutions, and I call this, MI also call this a change talk. So now we focus a little bit on control, confidence piece, a problem-solving phase. It is the most important thing is here reminding them who is in charge, and you can do this first recognizing past efforts. What have you already tried so far? Do you have any solutions in mind? What worked? What didn't work? And teens and young adults, right? They want to feel independent, so you better don't get drawn into this power struggle, right? It's a no-win game. So you can also support their autonomy through asking this question, like, what do you think you'll do next? What could you do? What solutions do you have in your mind? These questions show that they are in charge, not you. And it facilitates two MI spirit, which are control and confidence piece. And of course, you want to have positive influence of your child, and you want to offer advice, suggestion, and why not? That's totally fine. And they may or may not able to come to a good decision by themselves, right? And you may share some information. You can ask, can I make a suggestion? I have some ideas. Can I share them with you? And it is okay if they say no, but hopefully someday they will say yes. And the most important element here is asking their permission first, and coming here after spending time on providing reflection and questions. If you just jump to giving advice, they might feel shut down, and you would also miss the opportunity to learn about their own perspective on things. So then after making your suggestion, right, you can ask again, okay, what will you do next? What will be your next step? What will be your first step, etc. We don't want to imply that, okay, my suggestion is the best solution here. I know this is the hardest piece, staying calm piece. In order to have a challenging conversation with a young adult or a teenager, we have to be in a good place to think and respond intentionally. And our loved ones definitely know how to get us activated and triggered, and you need to ask yourself in those moments, okay, what set me off? How do I notice it? How do I get back to a calm place so I can think? I can try thinking something new, right? So you need to be calm first to be able to engage in a challenging conversation. So we say that secure your own oxygen mask first to be able to help your kid. So this is the intervention piece. Now I will quickly talk about the research piece. Maybe you are already familiar with this. The MILO is also evidence-based research. This is abstract, I know, but I will try to a little bit clarify here. As a MILO research team, we provided this training for people who identified as primary caregivers of individuals with psychosis. And this is pre-MILO levels, post-MILO, 8-week follow-up and 12-week follow-up. As you see here, their stress level, conflict level, decreased. Self-efficacy increased, expressed emotion also decreased. Expressed emotion is a very abstract term. It means that parents sometimes critical or over-involved or attitude because of feeling resentful or being burnout of their caregiving role. As you see here, even after 12 weeks, it seems like parents didn't go back to their prior levels of stress, which is a good sign for this training. So it shows us that MILO skills help them having more confidence in handling changing conversation, and it helped parents manage their role as caregivers. I think we see that a little bit shift in their caregiving role as well, and what they control and what not. I think this other slide even fleshed this out even more. We also asked them, what is the most important change you noticed since learning MILO skills? And these are the qualitative responses they give. For example, the children are willing to listen to me, not just dismiss what I'm saying. Conversations are not as intense or volatile. I have skills that help me cope and does help my children. Or I find that I hold back on criticizing my child for her decision, and instead I try to find out from her what her motivations are by asking curious questions rather than judging. I think I have more productive discussions with my children, and that makes me feel better about myself and as a parent. I think it helps them to have a better relationship and communication with their kid based on these answers, of course. If you are interested in learning more, I will share with you a couple of tools here. First is resources, and first resource is MILO Clinic. After the effectiveness of the training based on research outcome, we launched MILO Clinic at BMC to offer this service to community as a coaching service. And any caregiver who wants to learn MILO, regardless of the kid's mental diagnoses, they are welcome to join. So they are receiving 5 communications coaching sessions with a trained therapist. Based on the parent need, we do a couple more sessions, as also they are welcome to come back if they want to refresh their skills. And after they are done, we invite them our MILO weekly support group as well. It's a voluntary, of course, and we welcome couples, parents, grandparents, or sibling in a caregiver role. And this is our age criteria. Your kid needs to be between 12 to 35 years old. So we will be doing a lot of role plays in the context of your specific scenarios with your kids, and we will role play important conversations. This is an insurance-based program. If you call BMC and enroll with your insurance, and if you email this Learn About MILO with your MRN number, we can start sessions. Or you can just email here that I'm interested in MILO, then I will share this number with you. This is our also website that you can click, and this is actually kid doesn't have to be BMC patients. This is just for parents if you are thinking about that. So far, I think in 1.5 year period, we work with 30 people. Some of them were couples. So this is our second resource. This is an e-course developed by Dr. Emily Klein. It is, if you just Google School of Heart Talks online, it will be the first thing to show up. It's 7 interactive 10-minute e-lessons and take-home points. And another resource, the book, the School of Heart Talks book that Dr. Klein published recently. It is very easy read. I highly recommend. I will just conclude my conversation thanking MILO research team, MILO clinic team, as well as RAP program and BMC for housing our small clinic. So this is some of the publications. So I will stop here. I thank you so much for all attention.
Thank you so much. That was really, really helpful. And what an exciting overview of MILO and the research supporting it. So yeah, very exciting to learn about it. And I loved the interactive opportunities to try out our own motivational interviewing skills in the chat. So thank you very much for that. All right, so now we will turn over to our Q&A portion of the presentation.
Sure.
So if you have any questions, feel free to put them in the chat or in the Q&A box. And to kick off the discussion, I'll start with a question that I have. How did you first learn about motivational interviewing yourself?
Yes, you can find it funny. So I was a PhD student, and my program wants me to teach a substance use class. And I think they weren't able to find anybody else to teach that class. So I said, okay, I would teach. And that class included motivation and interviewing piece too. Half of the whole semester, I was supposed to be teaching motivation and interviewing.
Sure.
So I learned myself first. I taught myself, then I taught kids. So after that, of course, I get more official training outside of school as well. And then I met with Dr. Klein and I learned more about MILO specifically. This is how the thread is.
Sounds good. Thank you. So it sounds like it kind of occurred organically and then you saw additional training as you went, which is, I
Yes.
feel like, the case for so many of us too, including myself. All right. So there is a question in the chat. So one of our audience members asks, what is the difference between reflective listening and MILO? Would you mind clarifying how those things are related?
Reflective listening and MILO.
Yes.
Okay. And MILO give you as a whole package, I think, reflective listening and asking open-ended questions. And also you try to learn about the motivation of the other persons doing one behavior or another, so that you guide and hopefully help person to make choices together, maybe brainstorm the solutions together. So it's like a maybe whole package and a little bit maybe more organized. Reflective listening is part of MILO.
Yes, I think that's how I would see it as well, that we do those reflections and the listening as part of MILO and motivational interviewing. Yeah, great question. Okay, there's another question. Okay, do you think bribing is harmful in motivating someone to engage in change?
It's very complicated question. Bribing. I don't know what it means exactly in what context. I think when it becomes too frequent, probably wouldn't help, because it, I think, negatively impact intrinsic motivation, right? We want to build on the intrinsic motivation rather than giving external rewards. Maybe it can work for small kids. I don't work with very young kids, so I don't know. But for young adults, for teenagers, I think it is better to build on intrinsic motivation. Maybe at the beginning, a little bit bribing, I think, would be fine, as long as it doesn't turn into only way to bring the child to do something.
And I think you're bringing up a good point about how different strategies or tools can be useful at different stages in someone's development, from being a child to teen and adult, and also how things might work over the course of trying to support someone in change, the beginning conversations or later. And so I know, at least from the substance use field in general, certainly things like contingency management, where we use rewards that people can work for to, let's say, get a voucher or reward for having negative urine screens, for instance. That's an evidence-based approach that's been around for decades. It works well for the majority of people, but like for anything, it doesn't work perfectly for everyone. And so it's nice to have different options, and positive reinforcement is also useful, to encouraging behavior change, and that can work really well. But for any of these circumstances, it's not something we would necessarily do forever all the time. So for instance, if you're using contingency management where you're giving a reward for negative urine screens or whatever else you're trying to encourage, typically that would taper off over time as well, to your point about things changing in the beginning or later parts of recovery. And from the intrinsic motivation literature standpoint, it is true that some people have found, like, if you pay someone to do things, they might be less likely to sustain that change over time versus if it's something that they intrinsically or from within themselves just naturally want to do. And then they might find it a bit more fulfilling to do that. Would that be accurate?
Yes, and I think one more thing, by time people will be desensitized bribing too, and they will need more bribing, and
gotta watch out for that.
Yes.
Fair enough. All right. So another person asks, what if a child responds to, what do you think you'll do? That question, if we were to ask, and if they say, I'm not going to therapy, case closed, how might family members be able to respond to a situation like that, where a loved one is shutting down the idea of therapy altogether?
Okay. It's a great question, and probably you guys all hear 99% something similar to this. So if a child says case closed, right, you can't force it, right? I think first thing a parent need to think that you cannot totally control the child in the situation, right? And they need to step back. Child saying that I'm not going to therapy, case closed. This is very defensive reaction. Maybe saying something like, and again, going back to reflection, reflective listening. Okay, sounds like you are not going to therapy. It doesn't feel like a good time for you. Just making this reflection and see what the kids say. Maybe they will respond positively to this reaction, right? Maybe you can end, okay, is that okay that we would revisit this again? I know it doesn't, you case closed for you, don't want to talk about, I really understand, but in the future, do you think we can talk about it again? Leaving some open door there can be helpful. If he doesn't want therapy, we cannot force it right there, but we can do definitely some reflective answer that doesn't lead argument. It's the point, right? How we can have a less argument, have a conversation.
I think that makes a lot of sense, thinking about how you can keep that conversation open without necessarily agreeing like, okay, you'll never do therapy again, or really trying to force them to do it. I think those examples are really effective ones to use in the moment.
Yeah, just one more thing.
Yeah, of course.
Yeah, I think that's very specific, good question. Also, a parent can say, maybe I am not going to therapy, case closed. It sounds like you are firm. It sounds like you don't want to bothered by this. Sounds like maybe I am coming off too strong. Something like that. I think that would be very empathic reaction because this child feel very defended in the moment. I think it would be good to respond to that part in the moment.
Yeah. I think that could build a lot of empathy or kind of take some of those defenses down for sure. So I'm curious, in what other types of situations do you see families wanting to use MILO skills?
We had a very wide range of parents, and some of them struggling with anger outbursts with the kid. Some of them worried about treatment engagement, especially people with substance use, psychosis. Some of them it's about just working on their communication better. I saw a range on that.
That makes a lot of sense. And those are challenging areas to talk about for sure. How to manage some of those big emotions and also how to get a loved one in treatment when they may not be required to, from a danger to themselves or others standpoint. And also we see someone who could benefit from help. Yeah. So for one of the specific examples that I know I run into with some families that I've worked with, what might you recommend saying in a situation where a loved one does say that they are motivated or that they want to do something like, I want to go back to school, in the fall, but they haven't actually engaged or taken any steps toward that goal for the past several months. So, you've heard them, you haven't seen any change. How could you perhaps use motivational interviewing in a situation like that?
So motivation is there first, right? It's great, the child is motivated. So then you can think about change talk perspective. You can ask about what is your reasons to going to school? What is stopping you going to school? What gets in the way? Based on the conversation, what would be the next step? What needs to be happen you to start this plan? Something like that. This is more about, I think, change direction questions.
Yeah, those are all wonderful examples of open-ended questions too. And kind of the what's, things like that. And then also really getting at the underlying motivation for doing or not doing something and really exploring that without judgment. So we have a question in the chat about someone who has a son in their 20s who is not a talker. Some of us might be able to relate to that, and very quiet, especially when having these types of conversations. So do you have any additional tips on how to, maybe get them to open up a little bit? Because sometimes family members might feel this urge to kind of fill the silence and keep talking. And this person is not entirely sure if that's the best course of action. So what do you think?
this child has potentially psychosis. I don't know, it changed a little bit.
It's not entirely clear.
Yes, they don't have to clarify either. It's not a problem. I am bipolar, or yeah, I am just sharing that, especially in severe mental illness or complex mental health conditions. We know that the kids are internally very scared. They are very anxious, and they are very, very private. Especially we see this in psychosis. They are very private about the information, and because they are worried that if they share their feelings, that parent will be scared, parent will be worried about them, or people think that they are losing their mind, etc. This anxiety makes them shut down a lot and don't talk. So sometimes parents see that this is a defensive behavior, but actually they are trying to protect themselves and their parent from potential problem. So I always do this psychoeducation about severe mental health situation. If a child is not talker, in general, right, and you can do some simple talk, and we call it the small victories, right? How was your day today? Maybe talk about a movie, maybe something simple. Maybe it's about a concept, whatever they are, you think that they are engaged well, you can talk about things that they engaged well. So you can say, oh, it's maybe not a good time to talk right now. That way, even though you don't talk with them, you are showing that you respect their space.
Mm-hmm.
And these things, right, these are building blocks to have a communication and relationship. You can start from there.
I like that. That's so important to also remind all of us, that things don't change over time, and people probably didn't just start having a communication block or barrier per se, which means that it may have developed or evolved over time, which also means that it can change in the future too. It just might take time as well in these small victories. So another person shared similar to this question, what if your loved one says that they aren't going to therapy because it isn't helpful, but they won't answer some of those open-ended questions about why it isn't helpful. So would it make sense to perhaps use a reflection of that person's statement, that it's not helpful? Or is there any way to get a bit further when the loved one doesn't want to share anything about the therapy discussion?
These are great questions, so I like answering them. I think, right, they don't have to like therapy, this is their choice. They don't feel comfortable, it's possible, especially if there is psychosis and substance use issues, right? You need to change, right, especially for substance use, right? And therapy is very difficult. Maybe you can ask, right, what would you want from a therapy? What would be ideal therapy situation?
Mm-hmm.
What would make you feel more comfortable? What needs
I
to
like
be
that one. Yeah.
Just open up another perspective for the kid.
Mm-hmm. Thank you so much.
Yes.
So another person asks, my son wants to work out, for example, but his medication is making him lose his motivation and pleasure. So all this person can do is remind him, but it's not working. Anything else that this family member could do?
So I'm trying to understand the question. So medication causes him to lose the motivation?
It seems like that's the situation that's being explained, that given the medication, it might make it more difficult to feel motivated or experience the pleasure of working out, even though the son may have said that he wants to work out. So aside from reminders, how else could a family member respond in a supportive way?
Yes. And first, right, not forcing them, right, to engage in the workout if they are feeling lethargic about it. Of course, I think it's a conversation needs to be done with the medication provider too, if this medication really helps, really blocks that motivation, or it is about a negative symptom of psychosis too, that in psychosis or in depression and in bipolar, there is a lot of lack of motivation in engaging with social behavior or hobbies too. It might be about depression, it might be about medication. But here, trying to again understanding, asking like, okay, you it sounds, I think double-sided reflection would help. In one hand, you really want to do exercise. on the other hand, it looks like you don't feel the motivation. Can you tell me more about what stops you, etc.? Then you would have, I think, more rich data about that, what stops him. We don't know, because until we learn from their perspective, we don't know. It might be real other reasons.
Yeah, I think that's a great example of a double-sided reflection, and I like how you know, it can open up further conversation while recognizing some of the motivation and some of the challenges too. Okay. And let's see, so another person writes in, their son is experiencing psychosis and he's refusing medication because he truly believes that he is not experiencing psychosis, and that there are people out there who truly want to kill him. So how do you approach this from a MILO point of view?
Yes, this is a really challenging situation, and we have parents like that that's struggling with this kind of problem. So it means, I think this is, MILO becomes sometimes hard to use in those kind of contexts because the child is symptomatic and they are not open to the conversation. But person is really symptomatic, I think, in the moment, right? You don't necessarily affirm that they are followed by gangsters, or they don't necessarily make them anxious, right? But more about asking, how can make you feel safe here right now? Well, what can I do for you to make you feel safe? What can we do together? That way they would think that you are there for them, with a calming presence, they're safe. I think that would be the first step, because you're trying to build the relationship and communication in the moment. If the child is that much, symptomatic, I don't think forcing or trying to convincing him about that this is not true wouldn't work.
Right. I completely agree. Typically, we, instead of wanting to get into an argument about who's right or wrong in this situation, appealing to the experience, like what is the person feeling? Because that's real for sure. I think makes a lot of sense. Okay. We maybe have time for one or two more questions before our closing remarks. So if you have any burning questions, please feel free to put them in the chat. Otherwise, you could always, get in touch with us after the webinar as well.
Now I have one point.
Yeah, sure.
Until they are thinking about the question, and not every expression that I use will work for everyone. For example, recently I bring up a question, what gets in the way, right? It of course depends on how you ask, but the parent said, this question triggers my child a lot whenever I ask this. So, it's really based on the dynamic between you and your child. So you know the best how to approach your child. So I want to just share that.
That is so true. And also, for any of these specific questions about people's loved ones, unfortunately, we don't have the pleasure necessarily to meet all of those loved ones. So please, definitely refer to, the professionals that you're working with one-on-one for more medical advice. And this is just meant to be helpful educational suggestions. So I guess one last question that I would pose to you would be, I guess, what has inspired hope the most for you through the work that you've done with these families, with your clients, and using MILO?
What inspired my hope? What keeps me hopeful? I think parents' efforts, I see that a lot of parents are really looking for information out there. They find me after searching a lot of other things. So it is really giving me hope that they are really advocating for their kid. This gives me a lot of hope. And I also notice as they use MILO, they find it helpful, and it also helps the child too. This gives me hope that there is some positive influence that this training can also help through parents' involvement.
Definitely. Thank you so much. I really appreciate all of your insights, as I'm sure our audience does as well. And so I'm just going to share my screen now as we go over a few resources that could be of interest to all of you. All right. So just in terms of McLean specific resources, if you are close to Massachusetts or in the McLean network, there are lots of resources that could be helpful for folks in terms of support groups. You don't have to be from McLean as well. For instance, Joanne Grady Savard, our McLean Peer and Family Support Services Director, leads a group online for folks. We also have Lisa McLaughlin Charlin, who's one of our certified peer specialists with her own lived experience with mental health. She is leading a new Wellness Recovery Action Plan, or WRAP group, specifically geared toward families for Thursday nights, actually right after this from 6 to 7 p.m. If you're interested, feel free to get in touch with her, lcharland@mgb.org. And for some of our closing remarks, I just wanted to put our feedback survey link in the chat. So feel free to take a minute or two to fill that out. It's very brief. And then I just want to thank everyone who has made this webinar series possible and the research that we do possible, and certainly our funders for this particular Crafting Support Project webinar series. And of course, Dr. Ifekci for joining us. And next time we will have our next family webinar on Thursday, August 8th from 5 to 6 p.m. Eastern time again. And next month's topic will be on something called mental health first aid. And I just this week actually became a mental health first aid instructor, and our presenter will be Joanne Grady Savard, who is also an instructor. And so she'll be joining us to talk a little bit about what this area is, how it could be useful for us with our loved ones, our coworkers, anyone in the community to really promote mental health and well-being. And the other thing I will also share is, if you're looking for some additional reading or resources before our next webinar, every month we have these. I feel like I'm updating our resources list. So I'm going to put that in the chat, and it's a PDF. So feel free to open it up if you like. And it's just a list of different resources at McLean. We also have resources that are available in the wider community, certified peer specialist programming, things that are relevant for people who have experience with psychosis or substance use or mental health more broadly. And so I think that, having the MILO resource on this list is certainly a good one. And so if folks have any other suggestions of resources that you feel like would be useful for your fellow attendees or for us, definitely let us know, because I promise you this is not an exhaustive list. And if you have any other questions or comments for me and you want to get in touch, feel free to shoot me an email or leave me a voicemail. My contact information is on the screen. And somebody asks in the chat if we can distribute the slides from the webinars without waiting for the webinar recording to be posted. At the moment, we're not currently distributing the slides, I don't think. But if that changes, we will let folks know. And thank you again for joining us tonight. We really appreciate you taking the time out of your day to work on this. And as Dr. Ifekci said, I think that makes me super hopeful too, that, wow, gosh, like all of the people in your lives are incredibly lucky to have you looking out for them and learning all you can to support them the best way possible. So we look forward to seeing you next time, and I hope everyone has a great rest of the night. Thank you and take care.